Hi guys, just waiting for everyone to hop on. Happy Thursday. I'm on vacation next week, so I wanted to do a live chat before I left for vacation because I'll be out of touch for a little bit. I'm not going anywhere, just staying home, but sometimes the staycation is the best vacation. Hopefully I'm productive. I took some notes. I have a few topics I want to bring up, but if you guys have some quick topics, just send a comment and I'll see. Just make them short and sweet, and if there's some topics I can cover, I'll do that for us. I wanted to talk about outside egg banks. A lot of you donor egg recipients that watch my lives are actively looking for egg donors, and a lot of you know that we have very few compared to what we used to have. And when I say few, I mean we still have 50 or more donors. Hey Jackie, thanks for hopping on. Jackie is watching today. She can help answer some questions on the side there. Hey Sharonda. All right, so outside egg banks I wanted to talk about quickly. We are seeing a lot of recipients purchasing eggs from Donor Egg Bank, My Egg Bank, Cryos International, and Fairfax. I believe those are the four main outside egg banks we're using. You're always welcome to check with either myself or Jackie. We can check with you and find out if we've received eggs from a certain egg bank. Hey Wendy. And so you can check with us. The process to get those eggs from an outside egg bank is fairly easy as long as they are New York State licensed for us to accept them. It's a great option if you're not finding a donor in our program that is suitable for you. I know a lot of our donors right now do have waiting lists, and that can be challenging, so these outside egg banks are a great option. Let's talk about waiting lists really quickly before I move on now that I mentioned it. You can be on up to 3 waiting lists at a time. Some of those waiting lists are very long, but what I've been telling everybody is while you're on a waiting list waiting for a donor, a lot of the recipients ahead of you, they're also actively looking for egg donors. So a lot of them do get matched. And so with that donor's next available cycle, we go through, we review who's on the waiting lists. Actually, Molly Valenti, a lot of you have talked to through the patient portal. She does that. She reviews the waiting lists for us, finds out who's matched, who has embryos, and she moves those people out of the way so that we can address those that don't currently have an egg donor. So we can move through some of these waiting lists very fast, and then there's some waiting lists that people really want that donor. A lot of people really want her, and they're going to wait. So we don't mind you checking in, but again, we're not really updating those waiting lists until that next available cycle. Known donors are also an option if you have a friend or family member that's willing to cycle. It's always best if you are using a known donor to consider their age. Our donors in our program, our anonymous donors, are between the ages of 20 and 32. So if you want to bring in a known donor, your best results are probably going to be in that age range. You also want to consider their medical history and their BMI. Their BMI may give us an indication of how they're going to respond to medications. If a donor is needing medications more than our average dose, you may be responsible for additional medication fees. With a known donor cycle, the cost of that cycle covers pretty much everything up to your transfer. If a known donor needs more medications, you're responsible for those fees. And if your known donor is monitored outside our clinic, you're responsible for those fees as well. New recipients, Molly asked me to let you guys know. New recipient consults, the doctors are probably telling you you'll hear from the donor program within the next week. So the doctors then send us a message. Our first step with you, because it's really important to help us manage all of our patients, If you can log into your patient portal, Molly typically sends out the recipient information packet that gets uploaded under patient instructions in your portal. And she also sends a message with a link to my video on our website. The video on our website basically tells you everything I will tell you in a phone conversation. So it really helps if you watch that video, look over that recipient information packet, and then message either myself or Jackie or Molly, whichever's easiest. Let us know when you can best be reached. I like to put everybody new on my calendar. I schedule a time and I will call you. Sometimes I'm a little bit late because I get tied up with other phone calls, but I'll give you an approximate time to call you. That seems to work best. So if you can watch my video first, it helps to cut down on all the general information that we need to discuss, and I can get straight to your specific questions. That really helps. So I appreciate you all for doing that, and message us through the portal with a specific day and time, and we'll get to you, I promise. Donor sperm. A lot of questions come up about donor sperm and how do I order my donor sperm. We have a New York State approved sperm bank list that we can upload to your portal. With the sperm preparations, if you're having an IUI done, you want to get IUI ready sperm. If you're doing IVF or donor egg, you can really purchase any preparation of sperm. I always say the cheapest preparation is best. So ICI ready, IVF ready, or unwashed. Those are all fine. Some of them talk about motility, and I think the lowest total motile I've heard of is, and when I say total motile is the number of moving sperm in a specimen, is like 5 million. That's adequate. You only need 6 to 12 sperm, or depending on how many eggs you're purchasing. You only need that many, but we want to make sure there's good sperm. So it's good to start with a couple million so that when we thaw, we have good sperm to choose from. Advocate for yourself. That's something I wanted to bring up. If you know that your sperm is in Albany, while we are checking for sperm location, it's always nice if a patient reaches out and says, hey, Allie, my sperm's in Albany. Please have it sent to Syracuse. My donor's being retrieved in Syracuse. So I want you to be thinking about those things. I wanted to talk about sperm quality, and I know I've discussed this on other chats, but think about your partner's sperm. Is there a low count? Is there low morphology? Do we need to go in and retrieve that sperm via PESA, TESA, or whichever the urologist indicates is necessary? When we have a low sperm count, or we're using these methods to retrieve sperm, it's important for you to know that the quality of that sperm might not be the greatest. So if you can at all consider donor sperm in some of these cases, some extreme cases, it may be your best case scenario. It's important to keep an open mind. We want to help you, but there's only so much magic that the lab can do for you. And so if we're using PESA sperm and there's rare motile sperm, but they can find motile sperm, okay, great. But we don't really know until we try how that sperm is going to fertilize the eggs. Sperm is 50% of this equation. We can't always blame it on egg quality when our results aren't at their best. So just food for thought, something to think about, something to discuss with your partner. When using frozen eggs, two important things. It's not always best case scenario to use frozen eggs when we're doing PGT testing on your embryos. You should really start with the best products, so fresh eggs, fresh or frozen sperm. When I recommend against using the banked eggs, it's because we lose banked eggs in a freeze thaw. I talk to you guys about this all the time. It's common to lose a couple of eggs. You want to start with your best numbers. You want to start with a good number of embryos if you're going to be biopsying them and sending them off for testing. So consider using fresh eggs only when doing the PGT testing. And the other thing with the banked eggs I wanted to bring up, I always talk to patients about this when they're purchasing frozen eggs as an add-on package to their IVF. It's important when your retrieval is scheduled that you make sure that your nurse schedules your egg thaw. It's very important the lab has to prepare in advance for that egg thaw. You can't remind us on the day of, hey, I have eggs to be thawed, because the lab cannot just throw media in a dish and expect those eggs to survive. It's all a very particular procedure. So just some things to think about. Back to outside egg banks, I wanted to mention, because this has recently come up, that Albany has had training with certain egg banks, and Syracuse has had training with certain egg banks. It may be an important question for you to ask where your eggs need to go. There's a lot of moving parts in our office. We don't always think about that. But Albany tends to have more of that egg thaw training, while both offices do. I think that Albany has training for Donor Egg Bank USA, whereas Syracuse does not. There may be a couple others. I have to look into that. But it's an important question for you to ask, where should I have my eggs sent to? And we can look at that for you, make sure they get to the right place. And if they go to a center where you would prefer, if they go to, let's say, Albany, you prefer it to go to Syracuse, we can move parts. We have a courier service that transports our specimens from Syracuse or between Syracuse and Albany, so that can happen. But we want to have a good amount of time. Last minute switches can cost you extra money. If we need to use our shipping instead of a courier, that does incur fees. So if you know your sperm is in Syracuse and your donor's egg retrieval is coming up, check with us, make sure it's an adequate amount of time to get that specimen to the right office. I wanted to just say that our website has been updated, so check out our new website. There's a lot of new information there. And if you have any questions or suggestions, let me know. But yes, we have made some new updates. The website looks different. Take a look. I wanted to tell you all that I am off next week. So go easy on Jackie. I will be back. I'm only gone for a week. So any questions that can wait, please wait for me to return. But Jackie is here in the background to help. If any of your donors' egg retrievals are coming up next week, you will hear from the team to let you know when that's scheduled and to schedule sperm if needed. So I'm not leaving you guys high and dry. There's a whole team that works with me that will be covering for me while I'm out. But any questions that can wait, we do appreciate you waiting till I come back, just so that everybody's not bombarded with questions that can be answered when I return. So let me take a look at your comments. Let me see if there's any questions that I can answer while I'm here. How can we reduce chemical pregnancies? Can anything help with implantation issues for IUI or TI? So we do have an implantation enhancement protocol, and you may already have been put on some of these medications. Things like prednisone, 81 milligram aspirin, the low dose naltrexone, those all help to decrease inflammation and help with promote implantation. Lovenox, which is a blood thinner, that can be added. Intralipid IV infusions weekly, those help to mildly suppress the immune system so as to not having anything fighting off your embryo. So those are things that are important to consider. An HCG wash 1 to 3 days prior to embryo transfer. I'm not sure if we're doing HCG washes or when we would be doing them during an IUI cycle, but I would think that maybe before an IUI is done, you could have that done. PRP, intrauterine infusions, that's platelet-rich plasma. That's another option that can be added to your cycle to help promote implantation. You're always welcome to contact the nurses line with any questions. And if you want these to be done, it's very important for you to have these conversations with your nurses. Either if you're part of the travel client team, contact the travel client team, let them know your wishes, and remind them also. We have a lot of patients that we're treating right now, and we're human and we don't always remember everything. So advocate for yourself. It's important and it's welcomed. Hi, Christine. Is Humira crucial for implantation? Natalie, good question. Well, it does help with inflammation. It does help to reduce inflammation within the body. It can help promote implantation, but do I know whether you need it or the next person needs it? There is not really anything that tells us for sure if you need something. But if you're having continuous struggles with implantation, continuous failed cycles, it's something that we can add. Humira is one of the most costly medications that we can add, but it's certainly an option if you're able to afford it. Most insurances are not going to cover it, but I have had some savvy patients that have been able to find ways to get that covered. So you're welcome to inquire. Okay, so this is Pretty Girl. Hi, how are you? You are wondering if you should go with the IVF route or tubal reversal. You know, this is a hard question even for a physician to answer, and ultimately the decision should be between you and Dr. Kiltz or one of the other doctors. My personal opinion is you can be spending a lot of money on tubal reversal for that to end up not being successful. And so I would almost rather see any client go right to IVF. Not that I can guarantee that that's going to work best either, but at least with IVF, you know that the egg is going to meet the sperm, and we're going to be transferring an embryo if you're that person that is able to get fertilized embryos as a result. Now, if you're over 40 years old and maybe with a low ovarian reserve or poor egg quality, poor chances, maybe poor sperm quality, you really want to go over these options with the doctor and really find out what's best and most cost effective for you. So I would always lean on the side of IVF if you're asking for my personal opinion. Hi, Crystal. You're nervous for your FET. You know what? It's all an emotional roller coaster, and everything you're feeling is what everybody feels going through this process. So I get it. Christine, I have to get that recipient paperwork ASAP. Send me a message. I'm not sure what you're referring to, but send me a message, okay? If maybe I've overlooked something, or if you hadn't received something that I was supposed to send you, I'm happy to help. Maria, how long does it take to get in your system? Been 4 months you sent your application. I'm not sure what this is referring to. If you're a new patient and you haven't scheduled a consult, but you sent in an email, call the office and get on the books. Maybe we can trace that email back and figure out where and when, but you need to have a scheduled consult to get in our system. If you've already had your consult, send me a message through the portal. I'll reach out to you hopefully tomorrow. But if you haven't had a consult yet, there's nothing I can do to help you until you're an active patient, so schedule that consult. All right, Crystal, you started spotting during ovulation week. IVF due to male factor only, retrieval and fresh failed transfer in October. Had to take meds December to restart the period, but period came at normal time. couldn't do FET. I'm really not sure what went on there. Some people do spot during ovulation week, so that's not completely abnormal. If you want to message me through your patient portal and remind me, I can take a look at your chart and take a look at maybe what happened last cycle. Ah, you had a Tessa, I see. 2 hours to find 8 good sperm. You know, that's tough. I mean, how you wonder how good are those sperm, and I really wish you the best of luck. I hope that those sperm fertilize your eggs and give you good embryos. Hello, I am from Maine and was recommended to your clinic by another Mainer who loved it. Is there any benefit to an in-person consult versus a phone consult? The in-person consult is nice because we can do a full exam. We can do an ultrasound. Sometimes us looking at your uterus over an OBGYN, not to say they don't have the greatest skills in the world, but we're dealing with fertility clients every day. And so sometimes letting us have a look at your uterus while you're in office is great. I mean, we have so many patients that are out of state, out of town patients that monitor near home. And so if a phone consultation is what works best for you, we can make it work. But it's good to know if you have an open mind and are able to travel to our office should there ever be any questions. Sometimes having a good hands-on exam from somebody that's in our office is a better way to go. But again, phone consultation is absolutely fine. Is there any medication that will help increase egg quality? There is. We do some estrogen priming that can help, I believe, mostly with egg quantity. Human growth hormone with estrogen for a month prior. I know they're adding a medication called Orilissa for those that have had a history of endometriosis. And I feel that improving things within your whole body can really help your overall success. And so definitely reach out to talk to one of the physicians if you need to look into increasing your egg counts and quality. They're certainly going to make recommendations to you. CoQ10 was one that was a vitamin you can take daily to help improve the environment that your eggs grow in. And then DHEA is another supplement that you can take, but it's important to stop that, I believe, before egg retrieval. But again, reach out to your clinician and get some recommendations. Schedule a follow-up talk with one of the doctors if you feel like you're having an issue with egg quality and you need some guidance, maybe changes in your protocol to help improve things. My husband may not be able to come for my retrieval. Do you have good success with frozen sperm? No male issues. Yes, we use frozen sperm all the time. I would have them freeze. And sometimes what they can do from one sperm sample is break it up into multiple vials. Should you need to use a sample down the road, it'll already be here and in storage. So I've talked to the lab a lot about this, and they don't find that there's a huge difference. As long as sperm and semen analysis is normal or close to normal, it's fine. So go ahead and freeze. I go for my baseline test tomorrow. I'm cycle day 1. When do you normally start stims? Gabrielle, thanks for your comment. We usually start stimulation medications anywhere between days 3 and 5. I mean, if everything's at baseline and it's appropriate to get you started on day 2, we'll start you, but typically between days 3 and 5. All right, guys. Well, I don't want to make this too long. We're already at 24 minutes, so I am going to log off. Again, I'll be out next week, so I'll be out of touch. You won't find my name on the patient portal to message me, but I'm still here. I'm not going anywhere. I'm just taking a break. And have a great Thursday, and I will see y'all when I return. Take care.